The largest blood vessels in your body, your arteries, are responsible for carrying oxygen and nutrients to every organ, tissue, and cell in your body. It would therefore be an understatement to say that maintaining these critical channels in peak condition is crucial for your health. However, diseased arteries are a problem for millions of Americans. They suffer from atherosclerosis, an inflammatory illness that causes plaques, fatty deposits made of cholesterol and other substances, to accumulate inside of their arteries. These plaques obstruct normal blood flow and can cause heart disease, heart attacks, and strokes. According to some estimations, atherosclerosis is the largest contributing factor to strokes and Alzheimer's disease, as well as the underlying cause of 50% of all fatalities in Westernized societies. The good news is that there are several dietary changes you can make to reduce your risk of atherosclerosis and even reverse the plaque formation that has already occurred. If you haven't subscribed, please do so for more videos like this. 1. Salmon. Salmon, sardines, anchovies, and mackerel are among the fatty fish that are rich in omega-3 fats, which are potently anti-inflammatory unsaturated fats that protect against atherosclerosis and vascular inflammation. Omega-3 fatty acids can lower triglyceride levels, decrease platelet aggregation, which lowers the risk of blood clots, and raise levels of HDL cholesterol, which works to counteract the plaque-forming effects of bad LDL cholesterol. Additionally, studies demonstrate that individuals who consume 2 or more meals of fish per week are less likely to get carotid artery atherosclerosis. 2. Flax seeds. Along with fiber and the antioxidant plant components known as lignans, flax seeds are a strong source of plant-based omega-3s, alpha-linolenic acid, which have anti-inflammatory properties. Regular flaxseed consumption has been linked to better insulin sensitivity, lower blood sugar and insulin levels in overweight and obese people with prediabetes. Additionally, preliminary studies on animals indicate that consuming flax regularly may slow the development of atherosclerotic plaques. Just keep in mind that whole flax seeds don't break down completely during digestion, so use ground flax seeds instead and keep them in the fridge to get the most benefit. 3. Berries. When it comes to vascular health, blackberries, blueberries, raspberries, and strawberries are powerful contenders. The polyphenol chemicals quercetin and anthocyanins, which have potent anti-inflammatory and antioxidant properties, are abundant in these darkly colored fruits. Berries have been related to benefits in LDL cholesterol, blood pressure, and even blood sugar regulation, all of which help maintain arteries free and healthy, thanks to these components, plus a great dose of fiber. Berries are a particularly excellent choice for frequent consumption since they are low glycemic, meaning they are less likely to induce a blood sugar rise than other fruits like grapes, oranges, and apples, which are high in a kind of sugar called fructose, do. 4. Citrus fruits. Flavonoids, which are polyphenolic chemicals, are abundant in citrus. Due to their potent antioxidant effects, these citrus bioflavonoids scavenge free radicals that could otherwise lead to oxidative stress and promote disease processes. Citrus bioflavonoids in particular can aid in preventing LDL cholesterol from oxidizing into oxidized LDL, an even more harmful, inflammatory type of cholesterol that is strongly linked to atherosclerosis. A study indicated that individuals who had recently undergone coronary bypass surgery dramatically lowered their cholesterol and triglyceride levels by consuming 1 grapefruit per day. Citrus foods with less sugar are excellent. For a bioflavonoid boost, choose grapefruit, as long as it doesn't conflict with any of your prescriptions, or squeeze some lemon or lime into your water. 5. Extra virgin olive oil. Increased use of olive oil is linked to a lower risk of dying and experiencing cardiovascular events like heart attacks and stroke. So what makes olive oil unique? It contains a lot of polyphenol antioxidants and monounsaturated fatty acids. Research has indicated that MUFA-rich diets are linked to higher levels of good HDL cholesterol and lower levels of bad LDL cholesterol, while polyphenols found in extra virgin olive oil aid reduce inflammation, platelet aggregation, LDL oxidation, and blood pressure. Additionally, olive oil lowers blood sugar levels. One meta-analysis found that individuals who consumed the most olive oil had an average 16% lower chance of developing type 2 diabetes and lower hemoglobin A1C levels, a marker of average blood glucose over a period of several months. 6. Avocado. Avocados have two benefits for clearing your arteries. Like olive oil, avocados are packed with MUFAs that lower cholesterol and stabilize blood sugar. However, they also contain a surprisingly high amount of fiber, with each half avocado containing roughly 6.5 grams. A recent study discovered that consuming one avocado daily is linked to lower levels of LDL cholesterol. While some individuals are hesitant to eat avocados since they also contain some saturated fat, Dr. Brewer says you shouldn't be concerned about that. Although consuming saturated fat can raise LDL cholesterol, it usually only does so for the larger, bouncier LDL particles, which are less likely than the small, dense LDL particles to adhere to artery walls and harm them. 7. Beets. There is little doubt that red, golden, and rainbow beets are beneficial for promoting healthy blood flow, despite their contentious flavor, which has a distinct earthiness. One of the best sources of healthy dietary nitrates, which are transformed into nitric oxide in the bloodstream, is beets and beetroot juice. Nitric oxide lowers blood pressure and aids in preventing damage to artery walls that might make them more susceptible to narrowing and plaque accumulation by relaxing and widening blood vessels. Try roasting beets with olive oil or blending them into a smoothie to soften their earthy flavor. 8. Vitamin K2. A higher consumption of vitamin K2 may lessen arterial stiffness, delay the hardening of the arteries and valves, prevent diabetes and coronary artery disease, and minimize cardiovascular mortality. Some of the foods high in vitamin K2 is natto and sauerkraut. Natto is a Japanese dish that is prepared from fermented soybeans. It contains the highest concentration of vitamin K2 of any food and is high in numerous nutrients that support healthy gut bacteria and supports the blood vessels. 150 micrograms of vitamin K2 are present in 1 tablespoon of natto, or roughly twice the daily required amount. Fermented cabbage is made into sauerkraut, which has a distinctly sour taste. Similar to natto, this fermentation process has various health advantages, including enhancing immunity, supporting a healthy digestive system, and supporting blood vessels. The vitamin K2 content of sauerkraut is similarly high, at 2.75 micrograms per half cup. The condition of your arteries and the quantity of plaque they contain are mostly under your control. This is due to the fact that many of the primary causes of plaque accumulation and atherosclerosis may be changed by lowering body fat, increasing exercise, and purposefully altering your diet to include fewer carbohydrates, particularly refined carbs. If you enjoyed this video, don't forget to subscribe for more videos like this.